following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to Doctors on Call. Tonight's topic, women and heart disease. Two experts are here to answer your questions. Now here's your host, Dr. Joe Prudhomme.
Good evening. Tomorrow is Go Red for Women Day, and we're all encouraged to wear red to raise awareness of women and heart disease. Many people don't realize that heart disease is just as deadly for women as it is for men, especially after menopause. That's why it's so important for women to control their risk factors before they become life-threatening. How is heart disease diagnosed? What are your treatment options for blocked arteries? What can women do to prevent heart disease? We'll get the answers to those questions and more tonight from our guests, Dr. Laura Davisson, an internal medicine physician who's part of the WU National Center of Excellence in Women's Health, and from Dr. Brad Warden, a cardiologist and interim director of the WVU Heart Institute. If you'd like to ask a question, please give us a call. Our phone lines are open now. Laura, there's no doubt about it. West Virginia's women are at particularly high risk for heart disease. How big is the problem?
It's a big problem, unfortunately. We have a lot of women who are smokers in this state, and we also have a lot of women who are at risk for other risk factors such as high blood pressure and high cholesterol. Sometimes women don't realize that they are at risk for heart disease, but it is the number one cause of death in women. So if they don't know their risk factors, they should really go get those checked out. They can't do anything about their family history if that runs in their family. That's why it's really important that they get their cholesterol checked and their blood pressure checked and know those numbers.
Okay, cholesterol and blood pressure and smoking, big deal.
Mm-hmm.
So, Brad, heart disease in women can feel different than in guys. What are the symptoms of heart disease in women?
Now, that's true. About 80% of the time when a man has angina, he'll present with the complaints of a chest tightness or heaviness. That's only about 60% of the time in women. Women tend to have more vague symptoms, so your index of suspicion has to be higher. They may complain of things just like generalized fatigue, palpitations, shortness of breath. They also may complain of jaw pain, neck pain, or arm pain. So when you have those symptoms, you need to really be thinking about, as part of the differential diagnosis, coronary disease.
Okay. So we don't want to let it get to that point, though. Laura, how much difference can you make in your risk of heart disease if you do things right? Can you turn it around? Tell us about reducing the risk factors.
You really can, especially smoking. I would really like to emphasize smoking cessation. It's really important. A lot of women sometimes are afraid that they're going to gain weight if they quit smoking. And we do know sometimes you can gain a few pounds when you quit smoking, but you can take that off again. And I encourage all my patients to not worry about a couple pounds they may gain, but they really need to quit smoking. The other thing is cholesterol. If they don't know their cholesterol, they should have their doctor check their cholesterol. And a lot of times that's done with what's called a fasting lipid panel. Their doctor will have them fast for 12 hours where they don't have anything to eat. Then they'll go in, they'll get their blood checked, and they'll look at several different parts of the lipid panel, the total cholesterol, the triglycerides. There's the LDL, which is the bad cholesterol that people might have heard of, and then the HDL, which is the good cholesterol. And we want the HDL to be high and the LDL to be low and the triglycerides to be low. And so finding out about those numbers, then women can do something about it, whether they change their dietary habits or go on medication.
So those are important whether you're trying to prevent or reverse the problem. Is that right?
Exactly.
And Brad, how big a deal is exercise? I know you have to do it carefully if you've already got angina and heart disease. Tell me about how you get people exercising after they already have a problem.
After you've had a problem like a heart attack or bypass surgery, perhaps stent placement, a lot of times we'll put them in cardiac rehab. So, and at cardiac rehab, they'll teach you how to exercise under monitored conditions. They'll monitor your blood pressure, your heart rate, and so forth, and they'll have a prescribed regimen that you go through. And it teaches patients not to be the weekend warriors, but to start off slow and work your way up slowly so that you can tolerate that amount of exercise. Exercise is very important. They're recommending at least 30 minutes of exercise 5 times a week for general health. Exercise actually affects a lot of the other risk factors for coronary disease, including diabetes, cholesterol, hypertension, and so forth. So it affects a lot of different risk factors.
So how long would one have to exercise before you would start to see a benefit to your health, to your risk factors?
The recommendation is 30 minutes a day, and that can be split up into as short as 10-minute episodes, so 3 10-minute episodes and so forth. Most people find it more convenient to just do their 30-minute of exercise altogether, but sometimes it can be as short as 10 minutes of exercise will give you some cardiovascular effect.
So how many weeks or months do you have to do this though before I start to see my heart and lung function improve? Is it fast?
Yeah, yeah, absolutely. What happens is that your heart and lungs become more efficient, and we'll find that patients, that maybe could only walk a quarter of a mile, even in a month's time, are maybe walking a half a mile, and so forth. And in a controlled condition, monitored conditions, this is a very safe way to push yourself, basically.
Okay. And Laura, smoking, I know, is a big thing for you. It's not very long after you quit smoking you start to see the benefit from that. Is that correct?
That's right. People will feel better, and it'll also reduce their risk of having problems later on. So I encourage everyone to quit smoking. It's something that everyone can do to try to help themselves prevent heart disease.
Might be the single most important thing.
Mm-hmm.
So our first question tonight is from Wilma in Gilmer County. Wilma, ask your question, please.
The question is, does a lack of oxygen damage the heart? And what can it do over a period of time if it doesn't damage the heart? Can it weaken it? And how do you fix the problem?
And Wilma, how are you, when you say lack of oxygen, are you talking about you have a low oxygen saturation when they measure yours? And is that what you're asking?
I've had chest pains and aching in my chest, and each time when they get really bad, I go to ER. And this last time, the doctor said that there's nothing wrong with your heart, you just have a lack of oxygen, and it's getting worse. I did have a set of X-rays that showed the lower third of my lungs white, and I went to ask what those were, and I could not get a straight answer on that. Could that have a connection with the lack of oxygen?
Absolutely. Well, how many years young are you?
67, sir.
Do you smoke?
No, sir, but I've been around smokers off and on all my life.
Okay. All right. Brad, you want to talk about lack of oxygen and how it affects her heart and her blood vessel disease and risk?
Normally when we're talking about heart damage, we're talking about a blockage in an artery problem, so there's not enough oxygen being supplied to the heart muscle. I think in the caller's condition, because she's talking about a chest X-ray that shows the changes in the lower lobes, it could be multiple different things. Congestive heart failure is a possibility. Fluid on the lungs sometimes will show up as being white, but other times there's primarily lung conditions like pulmonary fibrosis, or sometimes chemical exposures like asbestosis and so forth can affect the lungs. Although it is true that you can get chest pain from blockages in the arteries, you can also get chest pain from multiple other causes, and it can be anything from the GI tract. Sometimes people will get it from underlying lung conditions, and sometimes the heart. So, working with your doctor and probably following up at an emergency room is a great place to get acute care, but probably going to see your primary care doctor and having him review the X-ray, review the findings, and perhaps seeing a pulmonologist if he feels that's necessary would be the next steps.
Certainly if she has changes on her chest X-ray that are that profound, I mean, it needs to be looked into in more depth. And Laura, correct me if I'm wrong, but secondhand smoking is pretty big risk factor for lung disease. Is that correct?
Yeah, we're finding out more and more that secondhand smoke can cause a lot of problems as well, and that's why a lot of places are banning smoking in public places, because it's unfortunate that someone who didn't even smoke can end up with some of the same problems just from secondhand smoke.
Well, women, we wish you good luck with that, but it sounds like something you should continue looking into aggressively, and I would do as Brad says, go see your family doctor first, and if you can't get satisfaction, then a pulmonologist is the name of the doctor who specializes in lung problems. And the lungs are definitely what gets the oxygen to your blood so that it can go through your heart and blood vessels. And it sounds like that is certainly an important factor for you. Folks, we'd love to hear your calls. The number's on the screen. Please give us a call and ask us your questions. We're talking tonight about women and heart disease, and we'd love to help you get healthy. I think that there is a real question in my mind about still we didn't give people a time about how long they have to quit smoking to make a difference, and I think it's nice as an incentive to tell them that their lung function starts to improve, their heart function starts to improve within a matter of weeks or months.
Absolutely.
Right? I mean, very quickly.
Absolutely.
So even if you smoked for 20 years, if you can stop, I mean, it only takes a few weeks, a month at most, before you start noticing an improvement in your breathing and you get healthier.
As with most systems, they don't just affect that one system. Smoking puts you at risk for coronary disease, for blockages in the arteries in your heart. It also puts you at risk for stroke. Other peripheral vascular disease, blockages in other arteries carrying blood to the periphery and so forth. But it also, of course, primarily affects the lungs. It's normal for lung function to drop off by 1% or 2% as we get older. That is more rapid with people that are smokers. And it increases your risk for pneumonias and other infectious diseases, too, because you don't clear those bacteria as well because the mechanisms that protect your lungs are adversely affected by the smoke. So it's not just one organ system, it's multiple organ systems that are affected.
It's horrible for the kids, too. It's not, even if you smoke outside, just the residue on your clothing is irritating to kids who have asthma and reactive airway disease and causes them lots of problems.
And women are getting more and more lung cancer too, and so it's really a shame that women have started smoking and are now getting more lung cancer as well. So, I know this show's about heart disease, but there's a lot of reasons to quit smoking.
Right. Lil, ask us your question, please. You have Lil on the line from Hancock County. What can we answer for you tonight?
Well, you can answer for me as I've aged, and I am currently 71, but into last year I noticed I walk a lot, and especially early in the morning, and last year my fingers would burn. I wore gloves. And into this year, my fingertips turn purplish, and then when I'm done walking, I come in the house. I swing my arms when I walk, and then I run warm water on them to get them like the circulation bad. And a friend of mine in the neighborhood said, well, she's a school teacher younger than me, and she said, I have that Renards or whatever, and she said, I use hand warmers in school. And I wore the double gloves, and sometimes they still burn, and I shake my hands when I walk. So I just wondered, would that be a symptom of anything clogged, or is it going to go to the brain?
Right.
I think what she's talking about is Raynaud's syndrome, and that is a condition where your hands will, especially when they're cold, will turn different colors and can feel tingly, and a lot of times people will just wear gloves and try to keep their hands warm to prevent those problems. It needs to be checked out to make sure it's not associated with certain other connective tissue disorders, but it usually wouldn't mean that there's a heart problem or circulation. It's like small vessel circulation, but it usually doesn't mean anything particularly dangerous as far as cardiovascular disease.
That's good. Yeah, it has a lot to do with the nerves that work those blood vessels. But hopefully it doesn't have anything, it shouldn't have anything to do directly with heart disease. So go see your family doctor about that. There are some medicines that can help with that, Lil, and good luck with that. And thanks for the question. Our next caller is Catherine from Harrison County. Catherine, ask us your question, please. Catherine, are you there? I think we lost Catherine. I don't have, I can't hear Catherine anymore. I see right now.
This is Linda.
Oh, okay. I'm sorry. Well, I got the wrong line. Well, please ask your question. We're happy to have it.
Okay. I was calling to tell you that I've smoked for 49 years and have angina, or however they say it, ×3. So I went to my cardiologist, and he said it was either die or quit smoking. And the branches out on I don't have no blockages in I had a heart cath, but it's the branches that come out from your heart is where it's blocked on the ends of them. So I quit smoking it's been over a month, and I can see a real big difference.
Wonderful. Well, we'd certainly encourage you to continue with that. That's fantastic. Why don't you talk a little bit about the difference between the larger and the smaller arteries? I think the smoking affects both, but more the small things like she was speaking of, isn't it?
Yeah, you're absolutely right. When you're talking about the branches, you can think about the arteries as being like the branch in a tree, the main part of the tree, the trunk coming up, and then the smaller branches coming off of it. Where you can do work with opening up arteries and so forth is in the main part of the trunk, but there are definitely smaller branches carrying blood out to the other portions of the heart, and we simply call it small vessel disease. That is best treated by anti-angina type medications, anti-chest pain medications. They're medications that make the heart, that take some of the stress off of the heart, make the heart go slower, make it ask for less oxygen. So that's normally what the cardiologist would do to treat that. The modifying your risk factors is still very important, though. The same risk factors for the blockages in the trunk of the arteries are similar for those in those small branches, and you don't want those to progress. So modifiable risk factors. I hear that you followed up with your cardiologist. That's great. Remember to keep your primary care doctor in the loop too, so you're all on one page as far as your therapies.
Well, thanks for that question, and congratulations on quitting smoking. I'm glad you can see changes already, and you're gonna keep seeing more. So we wish you good luck with that. Our next call is Roger in Randolph County. Roger, what's your question for us tonight?
Yes, the question I have, sir, is that my mother passed away back in 1985. Where she had a condition where the electrical system that powers your heart quit working. And it was supposed to be that we would get it as well. What can we do to keep that from happening?
Got it. Roger, how old are you now?
I'm 52.
52. And have you had any heart problems thus far? Have you experienced any yourself?
Yes, I'm having the electrical issue where I have to take a medication to keep my heart in rhythm. Because if it would stop, I black out.
Okay. Do you have any questions for Roger while he's still on the line?
Yeah. Do you have an irregular heart rhythm that we would call atrial fibrillation? Does that sound familiar?
Whatever I think sounds familiar, it would get so fast that it stopped. And then just wouldn't get back in time. It would, fibrillate, yeah.
Yeah. There's the top part of the heart can fibrillate and the bottom part of the heart can fibrillate. The top part causes your heart to be irregular. You have increased risk of having a stroke from a blood clot forming inside of the heart muscle. The bottom part can also fibrillate, and fibrillation of the bottom part is a situation that most people don't survive from. It would be called sudden cardiac death. And I'm not sure which one that your mother had and so forth, but certainly dying from those heart rhythm problems. Those heart rhythm problems from the bottom part of the heart are most commonly associated with blockages in the arteries. The atrial fibrillation that happens in the top part of the heart are associated with things like high blood pressure or thyroid disease, and also can be associated with blockages in the arteries too. So, do you follow up with a heart doctor now for your condition?
He's not going to be able to answer you. He's gone.
Okay.
You have to ask him while we've got him there.
Okay.
But Roger, I'm glad that you're getting it treated, and you need to keep on that. That's not something that you can ignore. So good for you for getting it treated, and we're sorry about your mom's passing. We got Catherine back. Catherine from Harrison County. We found her. Catherine, what's your question for us tonight?
Okay. Sorry, the operator cut me off. So I don't have a problem with my good cholesterol. It's about 98, but the bad cholesterol, my good cholesterol, I have a problem with. It's only like 34. How do I get that raised up?
Catherine, how many years young are you?
79.
And do you take any medicines for it at the current time?
Not for my heart.
How about for your cholesterol? Do you take any medicine for cholesterol?
No cholesterol medicine.
None. Okay.
I'm on blood pressure and thyroid.
All right, blood pressure and thyroid. Any other questions you want to ask Catherine before you give her an answer?
No, that's okay. So it sounds like her bad cholesterol, the LDL, is fine, but she has the low HDL, so she doesn't have high enough of the good cholesterol. And unfortunately, we don't have a lot of great medications to raise that good cholesterol. The best thing is exercise, as we were talking about before. Exercise is the best thing to raise that HDL up. One drink of alcohol a day can do it as well, but we don't really recommend that someone start drinking that doesn't already drink. And if you smoke, quitting smoking can also raise that.
That's about it, isn't it? So, Catherine, exercise is the best bet by far, and you usually see that respond pretty quickly. So, get somebody to help you start on a supervised exercise program, and that will help everything. And thank you for your question and for calling us back. I think the interesting thing is that almost everything that's bad for you, whether it's heart disease, diabetes, stroke, and now they're saying dementia, Alzheimer's, it's all the same thing. It's, the same treatment. It's stay appropriate weight, eat a healthy diet that's not high in carbohydrates and fat, don't smoke, and do exercise. And if you do those four things, then you don't get most of the bad stuff, and you live a long time.
And you kind of have to do all of them, too. A lot of times people would just say, well, I just want to cut fat out of my diet, but I want to keep eating too much and not exercising. You really have to have an overall lifestyle change, and you have to continue it permanently, make it a lifestyle change to really make a difference.
And sometimes it's easier to do big stuff all at once. I've got Adam on the line from Raleigh County. Adam, what's your question for us tonight?
Yes, sir. I'm a physician assistant student, and I was wondering, as a future primary care provider, what's the specific risk factors I could counsel women on for heart disease?
Specific risk factors that you can teach them to modify? Is that what you're asking?
Yes. Anything specific for women as opposed to just the general risk factors for heart disease.
Okay. All right. Anything else you want to ask Adam?
No, I don't think I have any more questions.
So are there any specific risk factors that are woman-specific in addition to the general risk factors for heart disease that he can counsel women to particularly pay attention to?
Yeah. They're mostly the same. They're mostly the same risk factors. Women do tend to get heart disease at an older age than men. So sometimes that's why they think they're not at risk, but they still get heart disease and they still have to watch all the same things. The diabetes, the high cholesterol, the blood pressure. They can't do anything about their family history, but they need to quit smoking. And those are really the same things.
So really the same risk, it's just their estrogen protects them a little bit in the beginning.
And that gives them maybe that extra 10 years before they would develop their heart disease.
If you graph the incidence of coronary disease with women and men, there's definitely a difference between the two lines until they hit menopause. And then the two lines converge sort of up into the 70s, and then they're basically the same out 3 years past that. So the estrogen is protective early, but you're right, when you lose that.
Yeah. The only other thing I would say is just to realize that they're at risk. And, some people don't think that their chest pain is chest pain. They don't feel it as a pain, especially women. It might be a pressure, a tightness, something sitting on their chest. And just recognizing that is probably one of the most important things that women need to realize.
Women will tend to delay 2 to 4 hours when they're having a heart attack more than men to seek medical help. And the most benefit that you get from seeking medical help if you're having a heart attack occurs within the first hour of the onset of symptoms. So they tend to be more stoic, to be honest with you, than men, and they tend to present later, and they tend to have worse outcomes than men when they do have heart attacks. So all those things together make heart attacks, actually the fatality from heart attacks is higher in women than it is for men.
So this is the same thing we learned when we did our program on stroke, that basically time is brain tissue and here time is heart tissue, and don't sit at home and hope it's going to go away. If you really think you're having a heart attack or a stroke, you need to get to the hospital ASAP, because the first hour is the time you want to.
Absolutely. You call 911 and get to the hospital. Unfortunately, up to 25% of patients that are having a heart attack actually die before they get to the hospital, and any delays in that care increase the risk of you actually dying on your way to the hospital. So calling 911 early, getting the ambulance to your home, getting into an institution where they can treat you for your heart attack is important.
So, folks, don't delay your exercise program, and don't delay if you have chest pain or think you're having a heart attack. We've been talking tonight about women and heart disease with Dr. Laura Davisson and Dr. Brad Warden. Thank you both for being with us. If you'd like more information, talk to your family doctor or visit our website at wvuhealthcare.com. For Doctors on Call, I'm Dr. Joe Prudhomme. Good night and good health.
Join us again next week for another edition of Doctors on Call. Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.